Welcome to the Queen of Hearts podcast. And here's the queen herself, registered dietitian Heather Klug. Welcome, everybody, to the Queen of Hearts podcast. I'm taking over hosting duties a little bit for the day over Heather. Today, we're going to be talking about navigating the holidays with diabetes. So we know the holiday season is fast approaching. I think we never thought we'd get here with 2020. Here we are. And this can be a difficult time for many people because let's face it, there's tempting food. We've got colder weather setting in. There's less daylight, more stress. And now we're just adding in COVID-19, which many of us means we can't spend time with our families during the holidays like we normally would. And this just kind of adds to the stress and anxiety that we would ordinarily be feeling already. So for a lot of us, that may mean stress eating or turning to other unhealthy habits for comfort. But for people with diabetes, the holidays can be an especially challenging time of year for managing blood sugar levels. So with it being National Diabetes Education Month this month, we thought we'd explore this topic in a little more depth. So hello, Heather. I forgot to say hi to you.
Yes, hello.
All right, so let's get started. And first, we should mention that people with diabetes are not more likely to get COVID compared to the general population, right?
That's correct, Bethany. The data we have so far does show, however, that people with diabetes have much higher rates, though, of serious complications and death from COVID-19 compared to people without diabetes. And the more health conditions someone has, the higher their chance of experiencing those serious complications.
Sure.
Yeah. Now, for people with diabetes, the risk for these serious complications and death from COVID-19 is much higher when blood sugar levels are not well controlled. So, meaning either blood sugar levels are consistently higher than recommended or levels are fluctuating all over the place. The biggest concern is with consistently high blood sugar levels. So, I just wanted to share with you a research study that was very interesting. And this is a retrospective multi-center analysis of 7,337 people with COVID-19, which included 953 people with diabetes. Okay. And this study showed that type 2 diabetes is associated with a higher death rate, but well-controlled diabetes had much lower rates of serious complications and death from COVID-19 compared to poorly controlled diabetes.
Okay.
Now explain to you how they defined poorly controlled and well controlled. So the poorly controlled group had an average A1C. Now, an A1C is this average blood sugar over like 2 to 3 months. Mm-hmm. So the poorly controlled group had an average A1C of 8.1%. This is a blood sugar of about 186. Okay. And they did much worse compared to the well-controlled group that had an A1C of 7.3%. So just slightly less. This is a blood sugar of 163. The well-controlled group also had no instances where mechanical ventilation or ECMO were needed.
Wow.
Okay. Yeah. So their outcomes were much better, right?
That's really good. And, like you said, it's not a huge difference between those A1C levels. It's about 0.8%.
Right.
So I think when we hear doctors kind of reiterating over and over again to people that it's important to continue taking your medications right now as prescribed, this is one of those cases where that helps control your diabetes if you're on medication, if you're doing other lifestyle things to keep your diabetes in check. That's also really important right now to keep your diabetes under control. So how specifically does having diabetes increase the risk for more serious complications from COVID?
Yeah, so recently we just did a whole episode on prediabetes. So
Hmm.
Kirsten, the nurse in the Karen Yan Center, she and I talked about the dangers of high blood sugar levels. So for more specific details on that, please listen to that episode. But basically, when blood sugar cannot get into the cells to be used for energy because of insulin resistance, they stay elevated in the bloodstream. And high blood sugar levels then damage the inner lining of blood vessels. They impair the immune response to infections. They promote inflammation, and it also impairs healing. So, high blood sugar also makes the blood thicker, like molasses, which makes blood clots more likely. And then these blood clots can travel to the lungs, heart, or the brain.
Right. And then that can lead to heart attack or stroke or death.
Correct. So there are multiple things going on in the body when blood sugar levels are high. And that's why you hear healthcare professionals emphasize lowering blood sugar to healthier levels. Now, add to this, people with diabetes often have other health conditions such as high blood pressure, high cholesterol, maybe carrying around excess weight. These health conditions also damage blood vessels and put wear and tear on the heart. And the preliminary research on COVID 19 shows that it largely affects the heart. So anything we can do to protect the heart is good.
Yeah, definitely. And not just for COVID,
Right.
like,
Just all around. Yes.
but extra positive for the COVID. So, based on what you said before when you were talking about that retrospective study, even small improvements in blood sugar levels can significantly reduce those risks and improve outcomes. So, how can people with diabetes reduce their overall blood sugar levels? And can this be done during a time like the holiday season where temptation is literally everywhere?
Yes. I mean, diabetes can definitely be managed over the holidays. It's doable. It's a bit trickier, right? Because of the foods often available. And we'll explore that in a little bit. I think it's best to start with the basics. So let me share with you some, key food tips to help manage diabetes. So the first thing to start with has to do with carbs, since those are the main category of foods that tend to raise your blood sugar levels. Okay. So my first tip is to choose healthy carbs and really just limit the amount overall. So when we talk about carbs, think anything starchy, think anything sugary. And the healthy carbs would be things like vegetables, fruit, whole grains, legumes, milk, and yogurt. Right? Most of these things I've mentioned have fiber. That's why you want to choose the healthier ones, because the fiber is going to help with slowing down digestion of the carbohydrates, right? So it's not going to cause a rapid rise in your blood sugar levels. The other big category within carbs to really, really focus on is really limiting those sugary foods and beverages. Those are the
Mm,
top two categories of added sugars. That's often the hardest part for a lot of people, right?
I would say, yeah.
Watching, soda and the, teas with a lot of sugar in them, coffee
Juice.
drinks. Yeah, even juice can add up really quickly with all the carbohydrates and then all the baked goods, sweets, and
Mm.
desserts, right? So,
Oh,
really
yeah.
limiting that kind of stuff. And then the last thing I'll just say about the carbs is, really just watching the portion sizes of them. There's no way to get around that. Even with healthy carbs, there's a point where we can just go overboard. And if you eat a large amount of healthy carbs, it can make your blood sugars go up as well. Now, often people ask me, well, how much should I aim for? And all of that really should be tailored to the individual. So, please check with your doctor, your diabetes educator, or a diabetes dietitian for the recommended amount of carbs for you to aim for meals and snacks. Okay. And the other important thing to know is that if you have diabetes, medical nutrition therapy and visits with a diabetes dietitian are covered through insurance. So
Yes,
please take advantage of those services. You just need to let your doctor know you'd like a referral for those visits.
totally. And I just want to add a little shameless plug for ourselves here. We do have a couple of earlier podcast episodes on clearing up the carb confusion. If you want a refresher on everything you want to know about carbs, right?
Yes.
So, continuing on, I in this category alone, I can see where things can get out of control because I know what's on my table during the holidays, whether I'm at my own house or I'm visiting someone else. We've got tons of starchy vegetables and starchy sides. And then for dessert, we have, like you said, the sugary beverages and all of the sweets and the pies and the cookies and everything.
Mm-hmm. Mm-hmm.
So, what do we do to start reining that in?
Yeah, you're right. That's a lot of carbs. Think of a typical Thanksgiving meal. It's carb city,
Oh,
right?
yeah.
So like you mentioned, most of the sides are starchy. There's mashed potatoes, there's stuffing, or some places they call it dressing. You may have dinner rolls or biscuits. Sometimes mac and cheese is at Thanksgiving meals. Some people maybe have all of those things at the meal. And then the sugary foods, you mentioned some of these, like the pie, but there's also stuff like sweet potato casserole. You've got the cranberry sauce from the can, right? So here's where all
Hmm.
the sugary stuff comes in. Not to mention, we maybe aren't eating sensible portions of these foods.
Yeah,
Over the
exactly.
holidays, right? So my other big tip, I guess, when you sit down to eat something is, to try and make sure you're eating balanced meals. So this
Hmm.
means make sure you're getting all the macronutrients. So you want a little bit of carbs, a little bit of protein, and maybe even a little bit of healthy fat at the meal. Protein is the most crucial because it digests more slowly. And if you eat a high amount of carbs and there's little to no protein at that meal, your blood glucose will most likely go too high. If you decrease the carbs and add some protein, then blood glucose levels won't go as high, if that makes sense.
Sure.
And then adding in a small amount of healthy fat also helps with satiety, that feeling of fullness.
Sure. Obviously, that makes a lot of sense.
Good, good.
So, what about, do you have any other extra tips or?
Yeah, the last main food tip I will mention that is especially important for people with diabetes is to eat regularly scheduled meals and to try to keep the amount of carbs fairly consistent from meal to meal. This helps keep blood sugar levels in a healthier range.
Okay. So I know that like during the holiday season, people sometimes will skip meals to like conserve calories so that if they're going somewhere later or they know that, there's going to be apps or whatever, they don't want to use up all of their carb earlier in the day. So what you're saying is if you're a diabetic, you need to make sure that you're not doing that because that could be bad.
That's correct. Skipping meals often results in what's called hypoglycemia or low blood sugar, which can actually be really dangerous if you have diabetes. This can lead to seizures, loss of consciousness, sometimes death. And when blood sugar goes too low, then people with diabetes have the tendency to overload on carbs to increase the
Oh,
blood sugar again because they feel crummy. And then you go all the way up. Now you have high blood sugar, right?
oh, geez.
So, yeah. And what you talked about before, like, maybe saving your carbs for later. So, eating whenever, can cause a roller coaster effect with your blood sugar levels. So they can be going, fluctuating between being high and too low, and they're going all over the place. And neither too high nor too low blood sugar is good for the body. The goal is to keep the blood sugar in a nice, healthy range most of the time.
Which seems pretty logical if you
Yes.
think about it. Just want to
Yeah.
maintain that nice level.
I mean, I know that's easier said than done sometimes. And I
Right.
know sometimes with the holidays, things don't always cook at the time you want. They're finished in the time you want them to. So you're eating a little bit later. But, just try to make sure you're eating close to normal eating times, right?
Sure.
Yeah.
So, all this talk about carbs, aside from making me really hungry, is a good segue to talk about healthy eating during the holidays in order to help you manage those blood sugar levels. So, what are some of your top tips for navigating the holidays?
Yeah, this year may be slightly different for people since there won't be I think, as many parties
We
and
hope.
gatherings, right? Or cookie exchanges. I know we're being told, don't go to families' houses and all of that. And
Right.
I'm guessing there just won't be as much partying kind of going on. My first tip is the one I personally practice, and this is keeping tempting food out of the house as much as possible. If it isn't there, you're less likely to go out and buy it.
True.
Yes.
I would say that I do that sort of, but I know, and I'm sure there's people out there, sometimes there are holiday foods that come out once a year that you just kind of are like, "Oh my gosh, I need to have that." So I try, if that's the case, I try to buy it once and then that's it. Like I like eggnog, but anybody
Yeah.
who's ever had eggnog, a little goes a long way.
Uh
So I
huh.
buy a small container and that's my eggnog for the season. Like
Okay.
once it's
Okay.
gone, it's gone.
Well, I like that you kind of keep things in check at least. So at
I
least if you're
try.
bringing it in the house, it doesn't sound like it's 20 things that, you're buying and
I was gonna
having
say
around.
not most days, no.
Yeah. And it's a small amount too. So I think you're handling that pretty well, Bethany.
Thank you.
So my other tips would be, this revolves around the baked goods and the sweets, trying to keep those things to a minimum. I know that's hard to do, but
Mm,
especially for the bakers out there, if you bake often and it makes a large amount, set aside some for eating for a couple days and then maybe think about freezing the rest.
mhm.
Right? And you have them for another time. They're not sitting out on the counter where they're tempting you and calling your name.
Right. And you may
Um,
have surprise holiday cookies for the 4th of July, you know.
there you go. There you go. Another option, I think, or a good thing to do for people who have diabetes, and this revolves around, the main holiday meals, but really limiting the variety of starchy foods that you have. Again, like we talked about, there's sometimes several options, like 3 or 4 different starchy food options. Maybe pick one of those or eat a small amount of both. So, like for me, I love stuffing. Like that's my favorite thing at
Mhm.
the holiday meal. So, I would much rather eat that than the mashed potatoes because I feel like I can eat mashed potatoes anytime.
Well,
You know what
see,
I'm
every
saying?
day
So,
is a
for
good
me,
every day is a good mashed potato day for me. I'm the
okay, okay.
opposite.
I mean, everybody's different, right?
Right.
So, whatever's most important to you, maybe you eat that, or if you love
Mhm.
them both, maybe you compromise and say, you know what, I'm just going to eat smaller portions of both of them then so I can enjoy them both. So, however you want to handle it is fine, but the main point is you're keeping the overall amount of the starchy stuff small.
Yeah.
That makes sense. All right. My next tip is to bring in non starchy vegetable side dishes, right?
Yes.
I don't know if any of you have ever gone
Please.
if any of you
Please
ever
do
go to
this.
other people's houses for the holidays, sometimes it's so much brown and white starchy stuff. Like,
Yes.
where's the color?
Yeah.
So bring in something green. So maybe it's like a green bean dish with some toasted almonds on top, or maybe it's Brussels sprouts, or roasted carrots, or maybe a salad. Fancy kind of salad. So just bringing in something so it's not too many carbs at the meal. Okay. This next tip, I'm sure everybody knows, but I'll just mention it. But making healthier versions of your traditional holiday dishes just to kind of lighten them up a little bit. You may or may not go for that one. I don't know. Some people just want to have their traditional stuff. Again, if you go that route, just watch the portion size there. Okay, next thing has to do with some of the beverages that we drink. Try to stick to low calorie or no calorie drinks. So, water, unsweetened tea, maybe all those different, flavored seltzers that are out there right now. If you feel comfortable with it, a small amount of diet soda as well. Okay. And then along those same lines, making sure we're limiting alcohol,
Yeah.
especially if it's the mixed drinks that you like. So, anytime we're adding juice and soda to things, that's where the carbs are really going to get out of control. So, keeping it to that 1 or 2 drinks a day. Okay. And then The last tip here, I'm just going to mention it, even though it's a different kind of year, but bringing a healthy dish if going to other people's homes. So we're not supposed to be going to other people's homes because
Right.
of COVID-19. I get it. So just something to think about for the future, because if you're not sure what people are making, if you bring your own dish, at least you know that's something you can have.
Totally. So now I'm going to ask this because I know after we have the great big meal, we like to go sit down and take the great big nap. But it's better to exercise because exercise can help us manage those blood glucose levels too, right?
Absolutely. Now, exercise is an area that tends to slip around this time of year, especially in Wisconsin as the weather gets colder.
And it gets darker earlier.
Oh, yeah, that too. That's kind of a bummer. Now, when we exercise, the reason why this is so beneficial is that glucose gets used as fuel. So it's very helpful in lowering blood sugar levels. So fit exercise in whenever you can, but it's especially helpful when done shortly after eating. Some research has shown that 10 minutes of exercise after breakfast, lunch, and dinner is more effective in lowering A1C levels than exercising 30 minutes straight. That's not to poo poo
Right,
30 minutes. So I understand this doesn't work with everyone's schedules either to be able to exercise after every meal. So,
right.
again, exercise whenever you can. Just, try to make movement a priority in your day.
Yeah. So stress eating or comfort eating also tends to ramp up at this time of year, right?
Oh, yeah.
So it could be from, in an ordinary year, this is a time of year where you're hustling and bustling and you have shopping to do and you have to take the kids to school to practice for their holiday concert and you have parties and all of this other stuff. But this year, even though we may not have all of that going on, we've got a lot of stress. People
Hmm.
might be grieving the fact that, they may be missing a loved one who's passed on, or they may just be missing the fact that we can't all get together this year. We have different challenges this year that are also coming alongside the same challenges we have every year. So it seems like everything's compounded. So what are your suggestions for handling this stress eating or the comfort emotional eating?
Yeah, I'll go through some tips with you guys, but if it makes people feel any better, about 40% of the population are considered to be emotional eaters. I would actually put myself in that category
Oh,
too. Yes,
okay.
I feel like I've gotten a good handle on it over the years. I've got it in
Mm-hmm.
pretty good control, but it pops up here and there for me too. Now, there's a difference between physical hunger and emotional hunger, and people often confuse the two. Compared to physical hunger, emotional hunger comes on suddenly and it craves specific comfort foods, right? We
Mm-hmm.
each have our own kind of thing we like, but it could be chocolate, cookies, ice cream, potato chips, something along those lines. It's usually not broccoli or baby carrots, right?
Much to your chagrin, it's not that.
I know. And emotional hunger often leads to mindless eating. It isn't satisfied once you're full, and it isn't located in the stomach, it's in our head, right? And emotional eating often leads to regret, guilt, and shame. But let's face it, eating makes us feel good, right?
Yeah.
It releases dopamine, a pleasure neurotransmitter. And things that have high amounts of sugar, fat, and salt, kind of those comfort foods I mentioned before, cause higher amounts of this dopamine release. So you can see why people gravitate to that, right?
Right.
Because it feels like a little reward. But unfortunately, this is only a short term kind of feel good. And then eating is also a way to really, to numb ourselves or distract ourselves from uncomfortable feelings. But then that dopamine wears off,
Mm,
but the feelings are still there, right?
right.
Those feelings that we're trying to avoid,
Yeah.
they still remain. It kind of reminds me of that movie Mall Cop. I don't know if everybody's seen it, but Kevin James's character is an emotional eater in that movie, and there's a scene where he's spreading peanut butter on bread and he's saying, "Pain, go away."
Oh,
Now, I know, right? Most of us probably don't say this kind of stuff out loud, but it's kind of what we're thinking, on the inside, really.
yeah. Well, I know that you probably have several strategies that can help us with managing emotional eating. And I know I don't identify myself as an emotional eater. I might be, but I don't think of myself as that. But I know one of my triggers for just like the mindless eating and the kind of just is it's boredom.
Yeah.
I've got nothing else going on. I don't necessarily know what I want. Something is sitting there. It looks good. I shove it in my face. It doesn't make me feel any better. So I find something else and I shove it in my
Yeah.
face. So what are some other emotional triggers and how can people kind of keep a handle on that?
Yeah, this is the first strategy is knowing your personal emotional eating triggers. So you mentioned boredom. That is certainly one of them. But it really could be any kind of feelings, whether they're positive or negative. They're usually negative feelings with emotional eating, though.
Mhm.
Stress is the other big one. That's a huge one that makes people want to eat a lot. And then nervousness. And then there can be things like social cues here. Different things that people do and say can be a trigger. And then also, even childhood habits can kind of pop up.
So is there any way to kind of keep track of that? That's a good way for us to keep a monitor of those triggers.
Yeah. Yeah. So the second strategy is to keep an emotional eating diary. Most people know about tracking food. So if you're an emotional eater, the best thing to do is to track both your food and your mood so you can help identify, patterns within yourself. You'll start to notice when you start to do this emotional eating, and then you can come up with, an individualized plan for keeping that in check. Okay?
Okay. So,
Yeah.
what about some non food ways to deal with these feelings, so that you can fulfill yourself emotionally without having to eat something?
Yeah, I'm glad you bring that up because this is another top strategy. So, what I'd recommend each person do if you're an emotional eater is that you create your own list of non food ways to deal with feelings so you can fulfill yourself emotionally. So, if you're feeling depressed or lonely, call a friend or a family member, play with a pet if you have one, look at photos that are very, meaningful to you. Those are just some ideas.
Mhm.
If you're anxious, it's great to be able to expend that nervous kind of energy. So, going for a walk or dancing to some music that you like, maybe squeezing a stress ball or getting out some weights and lifting weights might be some ideas for that. If you're bored, read a good book, maybe explore the outdoors, maybe pick up a hobby you haven't done in a while, or maybe even start a new hobby. And if you're exhausted, take a bath, maybe drink some hot tea, light some scented candles. Those are just some ideas to kind of relax and rejuvenate yourself.
Okay, so what happens if I do that and the cravings are still there? Because we all know those cravings. We've all had those cravings. What do
Yes.
I do?
No, that's a very important point. So, what we all need to do is we need to learn how to ride out the cravings. Most of the time, we're kind of giving in to them, right? Because they do come from out of nowhere, and
Hmm.
you think, oh, I'm hungry. I'm going to get something to eat, or I'm bored. I'm just going to go grab something from the cupboard. Instead, what you want to remember is that these cravings are going to come and go, almost like waves in the ocean, okay? And they go away in about 15 minutes, roughly. All
Oh,
right. So we just
it
need to
seems
be
longer.
it might, yeah. So, really, what you want to do is talk yourself through it, see if you can identify kind of what you're feeling. Sometimes you may not be able to pinpoint it exactly, and that's okay if you don't know. And then, what I would do though is give yourself a time limit to not eat. So, what I do is I'll say, okay, if I'm still hungry in 20 minutes, I'll come back and get something to eat. And then this is the next important thing. Then distract yourself, do whatever. Go through your mail,
Right,
and
yeah.
throw away the junk mail. Organize a drawer. Get your, healthy lunch pack for the next day. I don't know. Go do whatever. Do a crossword puzzle. I don't care what you do, but distract yourself. And then, you may find you even forgot about your own time limit that you set yourself. Most of the time, I forget that I even wanted to eat anything. I just needed to forget about it. You know what I
Yeah,
mean? But if you are really honestly hungry at that point, then you can come back and eat something, and you'd probably be in a better frame of mind to pick something healthy because it wouldn't be as impulsive.
that makes a lot of sense.
Yeah,
I
yeah,
like that you mentioned, identifying your feelings because I think sometimes we forget, and this is something that, I've dealt with mental health issues, is just learning to accept uncomfortable feelings. Like, we tend to think that the minute we're uncomfortable, we have to fix it or we have to make that feeling go away, when really they're a part of your life. And sometimes it's okay to just sit with that uncomfortable feeling for a little while, right?
Oh, that is so true. Yeah, you're right. We need to learn how to accept these uncomfortable feelings because they're going to be a part of our everyday kind of life. So we have to learn to not suppress them, just feel them, and that's okay. And when we don't suppress feelings, they actually lose their power and they kind of
Right,
subside. Okay. When we suppress them, that's when we tend to turn to the food or something else that might be kind of unhealthy for us.
right.
So we just need to learn how to kind of deal with these uncomfortable feelings that are going to pop up now and then. Now, I'm not a trained psychologist in this field, so if people need more help with emotional eating, certainly reach out to a counselor that's trained in that. I know there's lots of different meditations online as well that might be helpful in this regard. We can put that information in the show notes too.
Definitely. Well, thank you, Heather, so much for enlightening all of us about this. So, for those of you with diabetes or loved ones with diabetes, I hope the tips that we've discussed today will help you with managing your condition over the holiday season, especially the more challenging 2020 holiday season, because
Hmm.
let's face it, we're going to have a holiday season that's going to seem pretty darn strange, I think, for most of us.
Yes, yes.
So, but be that as it may, we will all have a decent holiday season, though it might look a little different, and we'll stay heart healthy, right, Heather?
That's right.
So, thank you everybody for listening today. And as we always say, be the ruler of your own heart. Bye bye.
Bye.
Thank you for joining us on the Queen of Hearts podcast. Our podcast is recorded here at the Karen Yance Women's Cardiac Awareness Center inside Aurora St. Luke's Medical Center in Milwaukee, Wisconsin. For more heart-healthy tips, info, recipes, and more, visit our website at www.karenyancecenter.org, like us on Facebook at Karen Yance Center, and follow us on Pinterest. If you like what you hear, subscribe to our show and be sure to tell your friends. Until next time, ladies, be ruler of your own heart.